Okay, so I want to talk about the post-operative complication. In a general way to say it, complications that occur following surgery. And this can be divided into immediate, that is during the process, some but early, just not too long after that. Perhaps after 2 to 3, after 2 days. That's when you see some of the early manifestations. And then late, meaning later on, beyond with the healing. And so we'll get to this. So I want to make this as simple as possible. It's going to be extremely logical. And you could just derive this by thinking in this manner. So first and foremost, if it's immediate, we have to generally think what we're doing. We are approaching this region of the body. And let's say you're making a cut. So first and foremost, you'll be seeing manifestations like bleeding. That is pretty obvious. You get a cut, you get a bleed. So the organ bleeds, organ or region bleeds. And the organ is usually surrounded by nerves, arteries, and veins. And these structures could be damaged, and each of them can have their own complications. So, damage of the surrounding structures. So, in addition to these nerves, arteries, and veins, you have adjacent organs. They will be damaged, they could start bleeding, they could lose their function. And also, when the process or technique is not done appropriately, sometimes you might overshoot. So in the sense, the organ might be damaged, the organ might be perforated, and this could worsen the outcome and or worsen the bleeding. And the bleeding that occurs immediately is usually referred to as primary hemorrhage. Now, this is something that is somewhat basic, but yet we covered quite a number of things because we were thinking in that pattern. And then after that, if you want to dwell and understand more of the complication that could come or follow, again in the immediate, just look at the things in the system-wide manner. So you can take the cardiovascular system. We already talked about the cardiovascular system most of the time because hemorrhage falls under that. When you lose blood, your blood volume in your body decreases. And what that means, your heart is now pumping less blood and also at the same time receiving less blood. And when an organ does not receive the adequate amount of blood, it goes into a state of increased demand for oxygen, starts becoming infarcted. So myocardial infarction is one of the complications. Then if we were to look at the kidneys, sometimes urinary retention will be there. Gastrointestinal system, you might be looking at vomiting, a gastrointestinal upset. And generally, I forgot to mention this should have been quite higher up. Pain is something that is pretty obvious. Right? So adequate amount of analgesics should be thought about at that time. So, and in addition to that, a very common lung problem, a respiratory problem, would be atelectasis. This is something which you will see. What atelectasis means is your lungs, they usually inflate. They expand and they collapse. In these individuals, right, when I'm saying atelectasis, the lungs are failing to expand. So they are in a continuous state of being collapsed. And there are certain risk factors that can predispose an individual to more of this. Like for example, if the patient is having already respiratory problems like smoking, then they're more prone for these things. And also, if you are under general anesthesia, then again the lung might have difficulty opening up. The same for obesity. So now I've taken a look at the immediate. It's more of a general knowledge thing, right? It's nothing out of the ordinary, but it's immediate. And then not too long after that, early, here's where you get your infections, your blood clots, your embolisms, everything that can, that takes a little bit of time to start off. Infection, you need the organism to come in, proliferate, and then cause you those symptoms. If it's embolism, you need these clots to be dislodged, and then, so let's say blood, if it is constantly in a state in one region, it might tend to clot, and then it's going to cause obstruction, or it's going to break off and go and obstruct somewhere else. So that is clot related issues. Right, so that is that. And finally, the late one. This is somewhat easy to think of, something that comes after a long time. So with terminology, so you can understand that it is going to involve scar formation. So scar is never, something that is smooth and all that, so it's pretty hard. You think of it like that. So when scar occurs in any kind of, path, it's going to be harder not only, and in addition to that, it is also going to tend to narrow that particular structure. So what that means is there's going to be a stricture, there's going to be a narrowing, there's going to be a stricture, and sometimes an obstruction. And also in the healing process, certain structures might become adherent to each other, and sometimes even a connection might form between these unexpected structures. And this connection is usually what they call a fistula. So now to simply put it, scar, narrowing, obstruction, fistula, adherence. Pretty simple, doesn't it? So that's kind of the end of it.